With us in studio, Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital, with us here at 1590 WAKR. Joe, sports medicine, and you wanted to go on the wrestling mat with us today.
I do, yeah. Sometimes the wrestlers are the forgotten athletes, and there's a lot of wrestlers in our region, and I want to point out a few things. One of the fun things, Ray, about sports medicine is there's differences in all different sports that you cover. So we call it kind of dance medicine, and we have specifics for gymnastics and football. Wrestlers have a lot of their specific own problems, and there's some good news to be had here. So I wanted to tell you a little bit about the good news.
Okay.
One of the things kind of frustrating is last weekend the weather did in the Dees tournament. And, I know you guys talked about that a little bit. It's such a great local tournament. I've been covering that for over 20 years in different ways. And the family puts so much time into preparation. And then we get a bad weather weekend, wipes out the whole thing. They plan for it all year. But the wrestlers really, this time of year, they're really ramping up. And one of the misconceptions out there is that there's a big drop in the number of wrestlers. And so I wanted to touch on the numbers. I looked down at state. I talked to some of my wrestling friends in the community, too. There has been a small drop in the last decade. In Ohio, we've gone from about 13,000 wrestlers to 11,000 wrestlers. Not a big drop, a little bit of a drop. In the U.S., we've gone from about 260,000 to 250,000, so not a big drop, but some drop. Lots of sports are dropping some. Of course, everybody's got their eye on football. To give you some perspective, there's about a little over 1 million high school football players. So we're at 250,000, 11,000 in Ohio of wrestlers. But a couple things that have been on the good news side of things that I wanted to point out. 3 of the areas in wrestling medicine that we pay a lot of attention to. Number 1 is infections and rashes. It's kind of unique with the skin-to-skin contact of wrestling with rashes. Usually this time of year, you're nice enough, we talk about the big 4 and rashes. We talk about impetigo, ringworm, staph, and we talk about herpes, and those are still out there. But I think we're definitely doing better. When you talk to the infectious disease people, like my brother who was on this morning, the amount of the really bad, complicated staph infections, the MRSA cases, do you remember, Ray? Now, that's almost 10 years plus ago that we had some really bad hospitalized fasciitis, full body sepsis kind of things, hospitalized, even some deaths nationally from bad infection. We think the word that we've gotten out about hygiene, make sure to keep the mats clean, make sure to keep the uniforms and equipment clean, and skin checks. When you see a rash, get on it early and don't wait until these rashes get to be too full blown. And I think we're doing a better job, at least at the state level. OHSAA, who I talked to, we haven't seen as many of the really bad cases of rashes and infections in the last couple of years. I don't want to start anything here, but right now, I'm giving you a historical perspective. I think we're doing the best we've ever done in rashes and infections. Number 2 area that I wanted to touch on is a problem area we had in this sport when I got into it in the 70s and 80s was the weight cutting techniques that people were cutting weight. Yeah. And you might remember, I had to look it up myself, but your memory's so good, you probably do remember. It's been 20 years now, 1997. We had 3 deaths in one winter in 97. A couple of college wrestlers, or a college wrestler from the University of Michigan, really brought the word out nationally, is the way people were cutting weight and dehydrating so badly. We had to do something about it in this sport. And shortly after that, what was instituted, Ohio was one of the leaders, I'm proud to say, was what was the weight certification program, which is before the season in Ohio. Everybody gets a percent body fat done by skin folds. Everybody gets their urine checked for dehydration. And then during the season and before matches and things, we can be checked again to make sure the kids are not cutting to an unsafe percent body fat. Now that all 50 states in the union, I'm told, have some sort of weight certification program. And in the last 20 years, less and less and less of those catastrophic cases that we just can't have anymore of kids dehydrating and even dying with kidney failure and other issues related to weight cutting. So
I think we've done a good job of educating people on the dangers of dehydration. Before we would say, oh boy, he's dehydrated, better get some water in here. But really that dehydration, I know you can speak on this from a medical standpoint, other body things start to shut down.
They sure
when
do.
we're talking dehydration.
They sure do. You are exactly right, Ray. And you know what, though? I'm a little bit into this protected medical area. I do have the perspective of 30 years to draw on to say that I think we're doing better, too. But it really heartens me to hear you say that you think there is better education, because we think coaches, parents, and most importantly, athletes are getting that education piece, and we're doing a lot better. At least we haven't heard as many of the cases.
I think so.
Thirdly is something that's just kind of one of the nuance but uniqueness of this sport is a thing called cauliflower ear. Are you familiar with cauliflower?
Oh, man.
We're seeing less cauliflower ear. This is, again, one of those experiential. Early in my practice, we'd see several a week this time of year. Then it was several a year. Now it's the rarity when a kid comes in. So it's a hematoma in the ear lobe area. When somebody gets kneed or elbowed in an area, they'll get some bleeding and a hematoma forms. And in the early stages, when there's still blood there, if you drain it, but then you have to close the space, we do a button technique where we'd sew a button on there to close that space down so it wouldn't refill with blood. You can avoid these things. But what would invariably happen, a lot of career wrestlers would get these, they would harden and scar, and their ear would look like a cauliflower, just like
I have friends today that have the cauliflower ear.
Yeah. Now, if you have somebody with a chronic cauliflower ear, our ear, nose, and throat doctors can do some things to make it look better cosmetically, but there are less and less people coming to us. So, again, the word is just simply wear your headgear. I know it's hot. I know when you're practicing, sometimes in the hot gyms you don't want to, but if kids wear headgear, gosh, there's a 95% reduction of cauliflower ear.
Well, back in my high school days, Joe, it was optional. I don't know. Is it mandated
it's
now
mandatory.
That you see? It was an option back when I went to school.
It's mandatory for the matches, but nobody can mandate, practice and stuff. And so kids take it off in the room and they think I'm not really doing anything, and then they get kneed or hit there and they get some bleeding in the ear canal. So those are three areas that historically I'd like to say we're doing better with wrestlers. Wrestlers are hanging in. There's a small drop off in the last few years of the numbers of wrestlers, but still it's a strong group. A lot of the wrestling purists tell me that at the end, when we get to the state championship, the wrestlers skill-wise are as good, if not better than ever. What may be happening to form a gap is a lot of kids who don't grow up doing the sport are not just jumping into the sport. So when we were in school, kids would come out for the first time when they were sophomores or juniors or seniors. You know what I'm saying?
Yeah.
And they didn't have as much of the skill of the sport. And now a lot of people start at a young age. They learn technique well. They tell me they're learning technique on the internet, so they don't have to go to coaches' seminars in California or Texas or something to learn the greatest techniques. And when we get to the end of the road, there's some really skilled and talented wrestlers. And I wanted to shine a little light on this good group of athletes that we have practicing in the world.
Going back to when you and I were in high school, Joe, those years gone by, I remember the staph infection. You would kind of say, oh, watch out, you might get a staph. Nothing real important. And we kind of put it aside a little bit that it wasn't that big. I think we've really been educated in the last 15, 20 years how dangerous this staph infection can be. Going back to the beginning of your statement how we're paying closer attention to these open wounds, to these rashes on the mats and such. We saw it in football locker rooms as well sometimes. And I think we've done a much better job at that, realizing the seriousness of a staph infection.
Yeah, skin checks we call it. Check each other.
Yeah.
Have your parent check you when you get them, because sometimes you can't see with these rashes yourself, and get on them early. And I gotta say, and I joke with you a lot, just I enjoy coming in and speaking with you. It's been 25 years now with you. Is you do a really good job in the community in bringing some of these things out. So I appreciate the role you have in this thing too. But I think we are doing a better job in getting the word out in things like rashes and dehydration.
I had one other question for you, because a caller sent me an email this morning, and he said, listen, I know you have Dr. Joe in this morning. He said, I've heard a lot about, and he's just jumping on board with a story about Isaiah Thomas. He said the hip injury that he had when he came to the Cavaliers. He said, was it dislocated? Was it broken? What was it? and will it harm him going forward? So I thought, real quick to summarize everything up, what was the hip injury, and will this curtail his career?
We're all watching IT very closely to see as he tries to round himself into form. Do you find yourself holding your breath a little when he gets knocked to the floor sometimes and things? It's a rough game and the way he plays it. But IT, we talked a little bit a few weeks ago, but in reiterating, it was not a dislocation. People don't dislocate their hip the way they do their shoulder or their kneecap and stuff in sport. For that to happen, that's a car accident kind of thing. Not dislocated. Not broken from what we heard, but there's some talk that he might have some wear and tear damage, that a lot of pro athletes have wear and tear in certain joints. But what was the real key was the labral tear. So one of the hottest things in the last 10 years of sports medicine is there's a cartilage pad that helps hold the ball on the socket, in the socket of the hip joint, and it's made of cartilage. It doesn't have full blood flow. So when people tear this cartilage, this labrum, they often will get catching and locking and pain in the hip. It's called a labral tear, and it's been very transparent. Everybody's talked about it, that he had a pretty bad labral tear. A lot of talk about whether to operate on it. Nowadays, a lot of athletes operate on it or treat it with a long-term rehab. He treated it with long-term rehab and no surgery, and so we hope that it holds up to the rigors of the season, but it's a cartilage tear in the hip known as a labral tear, according to every report I've seen.
All right, good stuff. Good seeing you again. We'll see you next week.
Thanks, Ray. Good to be in.
All right, Dr. Joe Congeni, Sports Medicine Center at Akron's Children's Hospital, joining us live in our studio.